Okay, great. Thank you, everyone. So I'm going to tell you a little bit about the Million Veteran Program, which I have been involved with for quite a long period of time. So the outline of my talk will be giving you a little bit of an introduction to big data, to then tell you about the MVP and how we've been using electronic health records for research. And then I'll move on to talking about a little bit, giving you a little bit of a hint of what we're doing with various diseases. So although I'll focus on age-related macular degeneration, please recognize that this isn't the only area that the Million Veteran Program is looking at. We're actually doing work on a variety of different diseases. So the road forward will tell you about other diseases that we're working on. So I'm hoping everyone can see my slides. So in terms of big data, every time we go see a doctor, our information is recorded in electronic health records, right? So the health behavior, all demographics, vital signs, all inpatient, outpatient encounters, laboratory data, as well as images and continuous data streams. Any pharmacy data that's there is all recorded. You also heard from Dr. Hurdle that in certain cases, they're collecting genetic and genomic data. So that too can get recorded into electronic health records. And the reality is that all of this then becomes not just part of the clinical ecosystem, but it also can become part of a research ecosystem. So what we've been doing in the Million Veteran Program is actually trying to use this data to get some more information about risk profiles for various patients and various diseases. So we've looked at the ophthalmology data, and in looking at the ophthalmology data for the VA, you can see that it's the oldest database that has had about 30 years of experience. There are 11 million veterans that are there. And there's 170 VA medical centers that have been collecting this type of data. And it's all been recorded centrally using, the oldest EHR, if you will, in the US. So using that information, so the Million Veteran Program actually built on that. And what they did was they added a layer of research information, which is to look at how genes, lifestyle, and military exposures could affect health and illness. And they've so far collected data on approximately 825,000 veteran partners, including genetic data. So here, the genetic data is being centrally collected, which is very different from what happens naturally in most electronic health record systems. Also, part of this is the fact that you have ophthalmology data. So ophthalmology has a lot of big data because of these big images that are collected. Unfortunately, in the MVP, we don't have access to the imaging data, not as yet. It is coming as the VA changes over their electronic health record system. But there is data on 4.7 million ocular ICD codes, and ICD codes are basically codes that are used to record some of these encounters that I described to you earlier. And along with that, there's survey data that we have. So we have some information on smoking and some other physiologic measures. And there were blood samples that were collected for genetic analysis. So I'm going to move on from talking about the general data collection, which occurred as part of the larger Million Veteran Program, to what we were doing for AMD. So as you know, age-related macular degeneration is a degenerative eye disorder that occurs much later on. And a picture shown over here, or the image shown over here, shows you what normal vision in an individual would look like on the left-hand side compared to how a person with AMD might see a particular picture. So the question then becomes, why study AMD and its genetic underpinnings? So when you're looking at the risk factors that are present in an individual, or really in a population, the most important risk factors are obviously things like aging, hypertension, smoking. So that's the demographic and environmental risk factors. But in addition to that, genetics plays a huge role. So what you're born with is very important as well. And so far, we understand some components of that, but we don't understand all components of that. So our interest was to try and figure out whether we could use the Million Veteran Program to do discovery of new loci or new genes that might cause AMD. So how do we do that? You have this big electronic medical health record system. What we had to do was actually define case and control algorithms. What that means is we had to come up with definitions for what was a case, what was a control, then deploy those algorithms inside the charts, and then look to see if we could find individuals who were true cases and true controls by actually doing very close chart review of those individuals. Once we had the system going, we had to do this 2 or 3 different times. Once we had the system going, we measured how accurate those results were. Once we got to a 90% accuracy, we knew we could actually do genetic analysis with this data. So that's how we defined our cases and controls. So we had a definition, which was 2 mentions of particular ICD-9-10 codes for age-related macular degeneration, and they had to meet certain age cutoffs as well, because age is a very important factor in AMD. In addition, so we were able to collect individuals who were of European American descent.
Dr. Iyengar, can you wrap it up, because we're almost
yeah, I'm almost there.
All right.
Okay. We have European American, African American, and Hispanic American individuals, and we were able to do analysis where we were able to find new genes. So there's only 1 or 2 takeaways I want you to get from this slide. First, the more hits you have, the more likely you are to get disease. The second, all ancestral groups don't have the same likelihood of getting these particular hits that are present across the genome. So in summary, we use the MVP data to discover new risk profiles. We actually double the number that were available, and we're planning then to look at a whole variety of different disorders going forward. In terms of the acknowledgements, I do want to acknowledge our partnership with the veterans, because they contributed towards providing their medical records and providing these genetic profiles for us to be able to find these new genetic risk factors. Thank you.
Thank you, Dr. Iyengar.